Gynecomastia or male chest enlargement is a prevalent condition we see and operate these days. So I'll be explaining in this video what is gynecomastia, why it happens, is it a serious problem, treatment options available, surgery for gynecomastia, the recovery period after surgery and the treatment cost. Hi everyone, I'm Dr. Prince, a plastic surgeon from Thrissur, and I'm practicing at Shushruta Institute of Plastic Surgery, Elite Hospital. So gynecomastia is a condition in which the male chest enlarges out of proportion. A few people have a doubt that whether it's just chest fat or gynecomastia. So it's simple. If you were feeling embarrassed of this chest enlargement and discouraged to remove your shirt in a pool or public, you have gynecomastia. The only thing to differentiate is whether it's a true gynecomastia or a pseudo-gynecomastia. A true one has both fat and breast gland component, while a pseudo-gynecomastia has predominantly fat. This can be identified by the clinical examination by a doctor. Gynecomastia usually starts at the age of 13 or 14 years, and in most cases it disappears on its own in 2 to 3 years. But if it doesn't, then it's very unlikely to resolve. Gynecomastia is caused due to hormonal changes in the body, a disturbance in the male hormone testosterone and female counterpart estrogen. In a few cases, it can be caused by certain medicines and other medical conditions. Most of the time, gynecomastia is not a serious problem, except for the psychological issues or embarrassment it causes among individuals. So, what are the treatment options for gynecomastia? So, if it's not resolved within the 2-3 years of its development, then as I told, it's very unlikely to resolve. Gynecomastia is highly resistant to exercise and dieting, but definitely you can give a try on these two. Surgery is the recommended treatment for gynecomastia, and the surgery is also known as gynecomastia reduction surgery. So what we follow in our department is that a keyhole gynecomastia surgery, which is a minimal access surgery using special instruments and modified techniques of liposuction. So the excess fat on the chest is removed by liposuction. The remaining tough glandular tissue is then removed through a small incision over the nipple, and the scars are small, not easily visible in most cases, and this method is better for Indian skin which are prone to have prominent scars. A custom-made compression vest is put on immediately after the surgery to reduce the swelling and fluid collection. Since the surgery is done under general anesthesia, usually we admit the patient one day before surgery and the patient will be discharged next day of surgery. And patient will be kept in ICU monitoring for 4 hours after surgery, and this will help the patient to get an absolute control over the pain and perfect monitoring for any expected complications. So after 4 hours of surgery, the patient will be shifted to the room. So now let's talk on the recovery after surgery. Minor discomfort and soreness can be expected in the initial 3 to 4 days, but patient will be able to walk from next day of surgery. Office work can be started after 3 days, but gym exercise and heavy weightlifting should be started after 2 months only. And the cost of gynecomastia surgery in Kerala can vary depending upon the grade of gynecomastia, but on an average it will be like 50,000 to 90,000 rupees. Thank you.